Welcome to the Healing Our Sight podcast. I'm your host, Denise Allen, and today my guest is Kristin Walls. She is a patient of Dr. Chula, who I spoke to in April. And I'm so glad to connect with you today, Kristin. Welcome.
Thank you so much for having me. I'm happy to be here.
I'm so grateful that you're willing to share your story. Just a little bit about Kristin. She is a stroke victim at age 30, which you don't expect to see someone your age in this situation at all.
Yeah, definitely unexpected.
Right. She's a wife and mother of 3 young children, ages 6, 3, and 2, and she's a second grade teacher. So you are a busy woman.
Very busy, but I love my littles.
That's awesome. And so this stroke must have sidelined you for a bit.
It sure did. Yeah, I had my stroke Thanksgiving morning of 2023. So we were on break from school.
Okay.
And then from there, I was hospitalized for a week in the ICU and then 2 weeks in inpatient rehab. So then I was off work the remainder of the school year. So
Oh,
we've
wow.
been, yeah, out of the classroom for quite some time and home a lot with lots of different therapies and recovery strategies in play.
Wow. Okay. Well, tell us a little bit about the kind of stroke that it was so that the listeners get a little bit more of a picture of what went on there.
Sure. So, my stroke was caused from a vertebral artery dissection in my neck. So, I was actually sleeping when my stroke happened. I woke up having my stroke. Um, the artery dissected, they think from an exercise I did the night before. I would always work out after my daughter went to bed. So, I went to sleep. I had a little bit of neck pain, but I just thought I kinked it doing something that
Mhm.
happens sometimes. And I woke up in the middle of the night with an excruciating headache. And I kind of realized my left arm was laying over my body. But when I first woke up, I thought it was my husband's arm. Like I had no connection to my arm whatsoever. It was pretty limp, and just dead weight. And then actually went to get out of bed at one point to walk to the bathroom and get some more water. And I fell right away. My left leg had lost its ability to bear weight. So at that point, we called 911. They told me after a set of CT scans that my artery had dissected, and with that dissection, it tried to clot itself and stop the bleeding on its own, and the clot went up to my brain and caused my stroke.
Wow.
Yeah.
Sounds like a rare type of occurrence to me. Is that the case?
Yes, I don't quite know the statistics, but it's definitely not super common.
Yeah. Especially not for someone that's 30, right?
No.
Yeah.
Yes, I was quite the show in the ER that night, in my local hospital, and then I was actually airlifted up to Northwestern right away from my local hospital, because they were just like, "We're not quite equipped for something like this." They airlifted me, and as soon as I got to Northwestern's ER, I had about 5 different attendings in my face asking me questions. It
Wow.
was it was a big deal to them.
Yeah. At what point did you come to be under Dr. Chula's care?
So after I had my stroke, like I said before, I was in the ICU for a week, and then I was in the Shirley Ryan Ability Lab for inpatient rehab for physical therapy, occupational therapy, and while I was there, I saw a vision therapist a couple of times, and that's where they told me I had the left-sided hemianopsia, so I had lost the left peripheral vision in both of my eyes. So after I was released from rehab, and I was at home, it was suggested to me that I contact a neuro-ophthalmologist. So
Mhm.
from there, I kind of, you go on Google, you start searching. I came to find out that those types of doctors are very busy and very booked. So I made a few calls, and my primary care doctor actually was the one. Someone else in my small town um, had something similar happen with their eyes from an accident that they were in, and my primary care was their primary care, so she referred me to Dr. Zost up in Northfield. And then I saw Dr. Zost at the end of January, and when I went back for my 6-week check-in, he gave me my very first pair of the colored lenses, the syntonic glasses.
Mhm.
So I wore those for 6 weeks, and when I went back to check in with him in the middle of March, I had asked him about vision therapy and, if they did anything online, if there was something I could maybe do, like Zoom calls with someone, because that's about an hour and 35, 40 minutes from where I live. So it was quite the drive, especially now because I can't drive with my vision.
Mhm.
Um, it was a lot to get to Dr. Zost. So he gave me Dr. Chula's information because she's only about 40 minutes from where I live. And from there, I had called her, kind of explained my situation. And that is where we started with the sensory integration therapy that's now turned vision therapy.
Okay. Yeah, she does a lot of different therapies, doesn't she?
Yes. Yeah. She is a very, very intelligent woman.
Nice. Sounds like it was a little bit of a challenge to find the right kind of help based on how
Yeah.
long it took you to get to her.
Yes, you can go on Google, you can search, you can call. I was very surprised. One of the doctors I called, I was calling around in January. I didn't get out of rehab until December 14th. So I started making calls after the new year. And some of the people were like, we have an opening in April. We have an opening in May. So it was
Oh,
very surprising to hear it be so far out and then have to wait that long. So once I was able to get in and know of Dr. Chula's office, I've seen her many times. Like, she makes a lot of time for her patients, and she's very, dedicated to answering questions and phone calls and messages. So she's lovely.
yeah, nice. So tell us a little bit about what you did first. You said you did sensory integration. Can you explain a little bit
Yes.
to people what that involves?
Yes. So Dr. Chula does something called sensory integration therapy where the way she explained it to me is it kind of helps wake up anything in your body that's lying dormant. So after my stroke, I had to regain strength in my left leg, my left arm, my left hand, and just coordination in general, along with my vision being an issue. So there was a lot of different things in my body that kind of needed to reconnect. And a big thing after a stroke is being active to get your brain to kind of help to rewire itself.
Right.
The sensory integration therapy is supposed to help do that as well. And it's supposed to kind of give a little boost to anything that's still working, just not quite working as good as it could be.
Mhm.
So she has this, I believe it's called a sensory cradle, but basically what it is a big padded zero gravity chair. And in this chair, there is vibration pads. And then in front of you, there's a big screen that different lights kind of shine on. So for your vision, they go in different patterns and different frequencies that match the vibration that is going through the chair, but also you're wearing headphones and you're listening to therapeutic music. So she's really getting all of these different things stimulated at the same time. And the lights kind of flash on the outsides for your peripherals. And then there's different parts where you focus, like at a center light. And the chair is constantly doing either clockwise or counterclockwise. Every day it was a different one. I'm not sure how often what the pattern was with that. But and then I had my hands on vibration pots as well. So your whole body was really stimulated. And then she also had infrared light pads that she would kind of lay on you. And it was really cool because every day when therapy was over, you could feel certain things in your body feel different. So because I had a stroke, there was a lot of things happening in my body,
Right.
but some days, the lights would really make, my leg feel better. Like, it would be really tight when I'd go in and not so tight when I'd come out. Or, after a while when I was doing therapy, I left rehab with an ankle foot orthotic. I had an AFO brace that they told me I'd probably always need. I was often told that I'd probably never run again, just because of the way that my ankle was locked and all of that stuff. After doing all of this stimulating therapy with Dr. Chula, I am now able to run. I'm not going to be running any marathons anytime soon, but I can actually do the act of running, which
Wow.
is pretty incredible. I don't have to wear my AFO anymore. The brace is no longer necessary. So, a couple things that we're supposed to, you're always going to need this brace. You're probably never going to run again.
Mm.
I'm now able to do those things because all of that stimulation and the way that that therapy just kind of woke things up in my body, it allowed my body to kind of heal certain things and regain some of those motor functions back.
Wow. So it's quite
Yeah.
different than, from the therapy that you had right after your stroke, right?
Yeah. So the therapy post stroke was mainly just physical therapy, learning how to walk again.
Okay. Because you said physical therapy and occupational therapy.
Yeah, the occupational is mostly for my arm. For a very long time, I could not lift my arm, move my arm. My left hand still needs some work, but my arm I can actually control now. For a long time, it was very much just kind of hanging by
Mhm.
my side. So there was a lot of work to be done there. And I will say that I do think her therapy helped with that mobility as well. I had gained a lot of my arm strength back before I started the sensory integration therapy, but even since then, just the control that I have because of the muscle spasticity that you can get after having a stroke, the
Mhm.
muscle control that I have in my shoulder and in my arm now is so much more stable than it was prior to the 12 days of sensory integration therapy.
Okay. Is that something that could have been done earlier on in your recovery if you had known about it?
Had I known about it, and done it sooner, I think I definitely think that it would have helped more.
Mhm.
I think that maybe some things had kind of tried to rewire and heal on their own. But had it happened sooner, I do think it would have been really beneficial seeing how significant the change was, even with just my being able to run now.
Yeah, that's huge.
Yeah.
That just it's
Yeah.
blowing, and people don't think about the fact that there are these types of therapies that the regular doctors are not going to necessarily tell you about.
Yeah, and it's amazing because when I asked about the vision therapy, I did not expect this. Dr. Zost, who I had seen first, he just said, vision therapy is really hands-on. So he's like, "You're gonna need to go somewhere." He's like, "I can refer you to someone else that I know." Little did I know that Dr. Chula and Dr. Zost went to optometry school together. So they actually knew each other personally. I didn't know that at first, but
Yeah.
so when he referred me to her, I was thinking I was going in to just do some eye exercises in person. I had no idea what door was going to be opened for me, but it actually turned out to be a really incredible opportunity.
Yeah. Well, it addressed more than just your vision, right? Which
Absolutely.
so unexpected and so wonderful for you.
Yes.
So she's doing some other therapies with you as well, correct?
Yes. So the sensory integration was 12 consecutive days
Mhm.
together. And then once that was over and it kind of, woke up whatever was laying dormant in there, I now have the at home therapy. I have a set of colored glasses. I was trying to count my colors, all of them except orange. Um, I have a set of colored glasses that I use with a pen light. So I kind of shine the light from seeing the light to not seeing in those areas where my vision is lost to try to stimulate that area. And then I also have a box that I use to do a kind of side to side vision tracking and up and down vision tracking where I put little lights in the bottom of it. So there's different color lights for that as well. So
Mhm.
it's she calls that my home program. So I do my home program and I check in with her. So I did 18 days after um, my sensory integration therapy, and I checked back in with her after 18 days of my home program. And there was actually a pretty significant difference in my vision at that point. I don't know all the technical terms, but on my charts that she printed out for me, we were able to compare and see different spots in my peripheral that had been missing that were now lighting up. I was able to register where those lights were coming in. Um, and her husband had said that, it was he hadn't seen many patients that had, changes like that in their vision, and he's been doing optometry for, I wanna say it was 30 years,
Wow.
right around there. So, it was a pretty significant difference. It was very exciting to hear and almost a little, like, I'm almost a little in disbelief that, like, I'm the one that they're talking about, but so, since then, now I continue to do that program at home every day, sometimes twice a day if I can fit it in, and then I will be checking back with her at the beginning of August to see what the last 3 months have been able to do. So, hopefully, fingers crossed, we're showing more progress.
Do you feel more that there's been more progress?
I do, yeah.
Or difference?
So it's so hard to explain it because it's such a strange thing in your eyes, but um in the far left corner of my eye, when I first had my stroke, I didn't see, there was no black spot. Everyone would just say, "Do you see black? What does it look like?" And I'm like, "I just don't see that." It was just a narrowed field of vision. And then after I started doing the 6 weeks with Dr. Zost with my first pair of colored glasses, and then, I remember I was on my second color with him when I had called Dr. Chula, and I had developed a gray spot in my eyes, and my brain went to the worst place possible. I was in tears. I thought I was losing my vision more, like, I thought it was going away, and I remember I'm on the phone with Dr. Chula telling her my story, and I ask her about that, and she goes, "Oh, that's good." And I'm thinking, "How is that good? Like, I don't understand."
Yeah.
And she goes, "No, that means that light is coming into your eye. You're seeing something instead of nothing."
Mm,
And I was just so happy. I was like, "Okay, how do I make this happen again? Like, how do I get more gray spots?"
right.
So once I started the vision therapy, the gray spot lightened. So peripherals are never going to be clear vision, but my peripheral, it started to show the difference between light and dark. So if I'm looking straight ahead, I can tell, if there's a window to my left or if it's dark to my left. So I'm slowly starting to gain that type of vision.
Mhm.
And now, since I've been doing this program for about 3 months at home after the sensory integration therapy, I now can I have another gray spot that has developed like more in. So I have a gray spot and then the far corner is lighter. So now I'm developing more places where I can detect light versus dark, or, yeah, a darker color versus a lighter color. So it's not perfect, but it's definitely changing, which is really exciting.
Yeah, for sure. So, is there any kind of a prognosis on the development of your vision? Or do they it's just you have to take it one step at a time and see how it goes?
Yeah, it's kind of a trust the process situation. We're slowly working into it. I do also take lion's mane. I don't know how much you know about that, but I was reading articles, and a nurse friend of mine sent me an article about lion's mane and how it helps kind of rewire your brain. And I remember telling Dr. Chula about the fact that I took lion's mane. She goes, "Oh, that's really good." She was very excited. So I was like, I trust this woman with my life. She is so enthusiastic and so devoted to her job and what she does. She gets so excited about all the little victories along the way. So I was like, if she thinks it's good, I'm going to keep taking it.
Yeah.
We do take my lion's mane, and I do my therapy every day. So I'm hoping that by staying kind of committed to the routine, it'll keep waking up whatever is in there.
Mhm.
Right now, I cannot drive because of the lack of peripheral that I have,
Right.
but we're hoping that maybe I can gain back enough degree, because you have to have, I believe it's 70 degrees of peripheral vision in Illinois
Okay.
to be able to drive. So we're hoping that we're restoring enough that I can do that. But
Yeah. That would
when
be
I was in Shirley Ryan, they didn't really say anything about restoration. There was never a talk of my vision coming back
right.
until I met Dr. Chula.
That is what I've heard a lot, actually. My friend, they actually told her that she was a good candidate for low vision, which is basically, you're not gonna gain any vision, and so you might as well get whatever help you can, kind of a thing.
Yeah,
And she actually got quite a bit of vision back, and
that's
things
amazing.
came back together. It was she said, and this is just review for people who might not have listened to that episode, but, she said that when
Yeah.
she woke up from her ocular stroke, everything looked like a Picasso painting.
Oh my
So,
god.
she was
I
able
can't
to
imagine.
put everything back together so it looked relatively normal again through the vision therapy process. So,
Yeah.
yeah, it was
That's amazing that she was able to work through that because I can't imagine waking up to my vision looking that way.
mhm. There are so many things that can happen to our vision. It's crazy.
I know. Yeah, I hate to say the word blessed, but it's like I am pretty blessed that I did only lose a small portion and that I do still see clearly, and this could have been a much more tragic story, and for so many other people it is. I'm very fortunate that I still have the vision that I do have and that I'm able to work with someone like Dr. Chula to try to restore the affected vision that I
Mhm.
lost from my stroke. So,
Yeah, that is amazing. Are there any other factors that have had a positive impact on your vision? Things that you've done
yeah,
differently?
they said a huge part of my recovery from my stroke was going to be like movement, moving my body, staying active. Um, my physical therapists were always talking about getting your heart rate up. So the goal is to get your heart rate up at least once a day, walking, whether you're doing a crazy amount of housework, whatever it is, you're getting your heart rate up. And I'm chasing toddlers, so
Mhm,
we're busy over here. So I think staying active as often as I can. I try to keep a fairly healthy diet just so that good things are going back in and helping kind of while my brain's rewiring itself, I'm feeding it as many good things as possible. Um, like I said before, I do take those lion's mane supplements, and I really do think that they are helpful with my brain and just the way that it's trying to heal and kind of remap itself.
mhm.
Um, my vision therapy is obviously an amazing part of that. And then when we had originally spoke, I told you I have a small inkling about that castor oil that I've been rubbing on my eyes. I'm still researching it, but I do think
Yeah.
maybe it's not just coincidental that when I started using that, I started seeing more changes. But
Mhm,
I think the consistency with the vision therapy and the light therapy that goes with your vision therapy, all of those things, the consistency of that is so huge. I think, it's really easy to, "Oh, I don't feel like it today," because it does take a while. There's a lot of different steps to my vision therapy. And
mhm,
I think just staying really dedicated to that and just trusting that process is the biggest thing with this because life does get busy and you do get kind of stuck in a rut sometimes when you're healing, and it does feel stagnant, and it's really easy to kind of fall off that wagon, and you're just kind of like, I just don't want to, I don't feel like it. But if you don't stay the course, you're never going to see what that outcome could be. I
right.
think consistency is probably the biggest part of all of this.
Yes, and the positive mindset that I feel like you have as well. It's kind of contagious. I think people will be able to hear that in your voice as they're listening to this, that you just believe that it's working and that it will continue to work, right? And if you don't
Yeah,
have that
I
belief, then you can't progress like you are, I don't think.
Yeah, well, thank you. I try to stay as positive as I can. I will say not every day is bright and sunny. I definitely have my moments where, recovery can be very sad or frustrating. Um, there's a little grief process in there for the life that you once had, but
Mhm,
I try to look at it as a way of regaining pieces of, I call it my old life, but regaining pieces of my old life, because if I ever want to recover, they say full recovery, but full implies 100% and nothing's ever going to be 100% the same. But if you want to recover and regain as many of those pieces of your old life back, you kind of have to force the positivity and just really like dig your heels in and commit to it. Otherwise, you're kind of setting yourself up at that point for a disappointment. And it's when you're already in the thick of a recovery and you've already gone through so much, I think it's important to remind yourself that you owe yourself that commitment so that you can see what's on the other side of it. There is life after stroke. There is life after a tragedy
Mhm.
if you allow yourself to have one.
Right. That is amazing, amazing advice. I love it.
Thank
Uh,
you.
are you feeling like you're going to get back to teaching again?
Yeah, I am actually going back in the fall. I will be back. I don't know exactly what today's date is. I will be back in a month. I My first day back to work is August 12th. Yep.
Wow. And hopefully you're driving by then? Is that the goal?
The hope is there, but if I'm not able to, luckily I don't work too terribly far from home, and I have two lovely parents who are retired that live 5 minutes from me that have offered to be my personal Uber drivers to and from work.
Nice.
So thank goodness for them. But the hope is there. We're working really hard with my vision therapy, and my husband helps me carve out time for it. It's an everyday thing, we never miss. So, we're hoping with the new sensations that I'm having in my eye, the new changes that I'm noticing, that means that I'm seeing enough to be able to drive, but if not, we'll keep at it, hopefully one day.
Yeah. Awesome. So, I guess that means that you're going to be doing the same kind of therapy work for a while, till you
Mhm.
get to the goal point, I guess, right?
Yeah, and I think probably even after that, I could see my vision therapy extending for years, just because I don't know that it'll ever be 100%, but obviously, as we age and we get older, things change in our bodies. And I just want to make sure that I'm maintaining. So as long as Dr. Chula thinks that it's beneficial, I will continue to do it. I actually bought my equipment from her and I brought it home. So now every chance I get to rub those little lights on my eyes, part of my therapy with the little, I call them my wands. I'm not the little light, to stimulate because it is both of my eyes. I do it at the same time, the left corner and the inner right corner, and we stimulate them at the same time. So every time I get a chance to get my little lights and stimulate that area, we pull them out real quick and
Right.
we do it. So I definitely see it being something long term, but it's kind of just become routine now. It's just part of the day.
Yeah. Well, I think there's a lesson in that for people too. It's what you take care of can improve, right? And we don't take care of our
Absolutely.
vision the way we should. And so,
Yes.
unless you're forced to sometimes, then you kinda go, "Oh, well, I this is a priority now because you know, it it's a problem that I have to address," but we don't wanna wait till it's a problem
Yes.
that we have.
Yes, absolutely. I think it's very easy to kind of let things slip, because if you're getting by, you're working, but I think that speaks to your health in general. I think we live in a time where everything is based on convenience and I want it quick and I want it now. And Amazon is 2 days shipping and I can DoorDash lunch to my door in 10 minutes. And there's all these things based on like immediate convenience and like the girl from Willy Wonka, like, but I want it now. And you can't have everything right now. And sometimes you just have to be patient and you have to trust the process and you have to kind of commit to things in order to get that outcome, your health. And when you're in a healing process, that's not something that's convenient. It's going to be tricky. It's going to be difficult. But it's not something to rush. Healing especially is something that you have to really take your time with and listen to your body. And just be very mindful of each part of that. What, like, how much are you giving to it? What is your body telling you about it? Um, but yeah, our health can't be a convenience. It's just got to be a priority.
Right. Right. Well, I love your story. I think that people are gonna get so much out of it. So I
Thank
appreciate
you.
so much you sharing with all of that with us today. Do you have any last, words of advice for people as we end today?
Yeah, I mean, I think my biggest advice, and I know I've said it a few times, but you really just have to listen to your body and your needs and trust that process and kind of put the faith in your doctors. I know Dr. Chula's approach is not something that a lot of doctors do, but had I not sought out any type of, resource, I was really digging for things that could help me improve. And, it's okay to call more than one doctor. It's okay to explore different things and find what works for you. And some of those things might be a little unconventional, but had I not trusted Dr. Chula, I would not be in a position where my vision is actually being restored. Um, I had actually done a talk at the Joliet Junior College with one of my professors, and we were talking about just asking important questions about your health, maybe to more than one doctor. You don't just take one answer for it. There's nothing wrong with a second opinion, a third opinion. This is your life, this is your health, and it's really something to take seriously. It's easy to say, oh, they're a professional, like they know what they're talking about, and take one answer and go. But when you become in a situation like I did so quickly, where so many things can change and be different, it's really, really important to be your own advocate and to really just explore all of those avenues. Especially our healthcare system here is a little bit tricky. Sometimes it's not always straightforward and things aren't always readily available because of insurance or location or whatever the case is. And I think it's really important that you really push and advocate for yourself, but also kind of back to trusting that process and just realizing that it's not always going to be immediate. It's not always going to be at your fingertips all the time. You're going to have to really find the doctors that work for you, the things that work for you, but then also be patient with yourself. Allow yourself the time and the grace to heal. Your bodies have been through so much and they do so much for you on a regular basis that you kind of got to give your body that time to absorb everything that's going on with it and use what you're giving it to recover.
Yes. Well said. I love it. Thank
Thank you.
you for sharing that with us today. I will look forward to hearing what happens down the road. How much
Yes, thank you so much.
you gain back. It's gonna be awesome.
Yes,
Okay.
I'm very excited. Dr. Chula has definitely given me a huge piece of my life back with this restored vision. I get to go back to work now, so one piece at a time.
Nice. Thank you for listening to the Healing Our Sight podcast. I'd love to hear from you. If you like this episode, please share it. And please join our Facebook community at Healing Our Sight to leave suggestions or comments. Have a great day.